Canada's first known case of a new COVID-19 variant that has quickly circled the globe has been detected in British Columbia. CB24's Eden Debeba is live now with the latest on the response and reaction. Eden.
Well, the reaction has been great, Nick, especially considering that person, the first known case in Canada for the variant BA.2.86, never actually left the country. It's something that's got a lot of people talking. We're joined now by Dr. Vanita Dubé, who's the Associate Medical Officer of Health for Toronto Public Health. Doctor, thank you so much for joining us today. Walk me through your thoughts and feelings hearing this story out of BC. Is it influencing anything here in Toronto for you?
Well, we're out of the pandemic, but we're here with COVID, and we can expect that there will be new variants of COVID around the world and even in our own city and our own country. So that part is not unexpected. We are preparing for an updated booster vaccine to be available this fall. Health Canada is set to approve it sometime. And once it is available, we will be rolling it out in full force in our city.
And walk me through that potential rollout plan. Will it be a week after Health Canada sends that out, a little bit sooner, a little bit later?
As soon as we have the vaccines in our fridges, we will be able to have them available for those who are eligible. The vaccines will be available at our Toronto Public Health clinics. We will have mobile clinics. Toronto pharmacies will have the vaccine, as well as primary care providers who have been giving COVID vaccines as well.
Mm-hmm. And in the meantime, until the vaccine actually comes, how is the city tracking the number of COVID-19 cases here in this city? Are we still focused mostly on wastewater?
We have wastewater data that tells us what's going on from a population level. If you actually looked at the wastewater data, our COVID levels are low compared to where they were even a year ago. We also do track confirmed cases. So of those who get tested, especially those who are hospitalized, we track that, and that is available on our website as well.
Mm-hmm. And aside from Health Canada's research, are you guys also following the World Health Organization when it comes to recommendations from them with vaccinations and with this variant?
We follow the guidance from the National Advisory Committee on Immunization, and certainly it's the province of Ontario, the Ministry of Health, that provides provincial guidance and eligibility for our residents here in the city. And we make then the vaccine available to whoever is eligible.
We typically go into flu season around this time, but coupled with COVID-19, some people are concerned RSV also on the rise. Walk me through some advice you have for parents and anyone watching right now, especially as kids go back to school.
Yeah, I mean, we're heading into the fall, and we actually have this conversation every fall, even before COVID. But now we have, in addition to influenza, RSV, as you said, we have now COVID as a respiratory virus that we can expect will increase this fall. So what that means is when the flu and COVID vaccines become available, let's all be prepared to get vaccinated, because we know that that's an important step we can all take. But we can also always remember, if we have symptoms, let's stay home. Let's not further infect others. Let's wash our hands often, cover into our sleeve, for example, and let's protect those who are most vulnerable from getting sick as well.
A lot of important advice there. Always good to hear it again. Dr. Vanita Dubé, Associate Medical Officer of Health for the City of Toronto. Thank you for joining us.
My pleasure.
And Nick, I'm going to send it back to you at the desk.
Okay, Eden, appreciate that. Thanks so much. Eden Debeba live in our studios.